Hello everyone, let's talk about unexplained infertility. It's an extremely frustrating diagnosis which is seen in almost about 15 to 30% of infertile couples. Why is it frustrating? Because the patient has had all the routine investigations to try and find out the cause of infertility and it all says everything is normal. The patient's tests conducted for ruling out anovulation are all normal. She's having regular cycles. Her egg is getting released every month. The husband's semen parameters are all normal, and an HSG or a laparoscopy done to rule out any tubal factor shows that both the tubes are open and functioning normally. Then what is the reason for this diagnosis? Why is the patient still not conceiving? Well, one of the most common causes of unexplained infertility lies in functional defects. It can be because of poor functioning of the sperms. It can be because of poor quality eggs. It can be because of non-functioning of the tubes. Mind you, most of the tests which are done for tubal patency only look at the anatomical patency of the tubes. There is a functional component of the tubes which none of the tests really look at. So that can be a very important underlying cause of unexplained infertility. Unexplained infertility is called so because the normal tests do not reveal any abnormality. But that does not mean that something is not wrong. These patients might have some functional defects, and these are usually overcome by IVF or IUI. A lot of times patients with unexplained infertility might be having something called as a subfertility, where they might have require slightly more time than a regular couple in order to get pregnant. For others, there might be poor quality gametes or poor functioning of the anatomical structures or the gametes. So as a result, IVF, ICSI, these are treatment options which are not only therapeutic, but they can also prove diagnostic for these patients. So what happens in IVF is we tend to take out the eggs directly from the ovaries, combine the eggs with the sperms in the laboratory, and transfer the embryos which are formed into the uterus. The entire procedure is broken down. The entire procedure of conception is more or less observed in the lab. A lot of times when we do an IVF, we pick up that these patients have poor quality eggs. They might be having empty follicles, where you're just seeing a follicle growing, but there's no egg inside. At times you see that the fertilization rate is very low. You see that the patient has a lot of eggs, but the number of embryos which are forming with the eggs are very less. Or at times, these patients have excellent results in IVF, where they get a good number of embryos, they conceive easily in the first go, and where we are forced to think that maybe it was an underlying tubal factor which was responsible for infertility in these cases. Sometimes patients for unexplained infertility might get a good number of embryos, but then there is a problem with the implantation, where the normal transfer procedure is not really yielding success. So it's very important to understand that unexplained infertility is unexplained because your normal tests are not revealing what is wrong. But that doesn't mean that there's nothing wrong. There is definitely something wrong which an expert should help you in picking up and in overcoming.